Hi there, welcome to Lift. My name's Dawn and this is my beautiful assistant Melissa, and today we're going to talk about my most favorite subject here at Lift, cosmetic injectables. We offer several different kinds here. First I'll focus on our neuromodulator. We use a product by the name of Dysport, which is in the same family as Botox, which I'm sure you've heard about, Xeomin, and something, it's a little bit new on the market, the nickname is Newtox. They are all fantastic products. They all work really, really well. We like Dysport, we landed with Dysport, but if you're familiar with any of the other ones and have used them, good for you, love them. I'm just going to do a little bit of explaining about the reason that we chose Dysport as our neuromodulator. So Dysport and Botox are very, very similar, but there are a few distinctions between the two. If you've ever had Botox, you know that it can take anywhere from 5 to 7 days for the onset. With Dysport, it's typically 3 to 5 days, and as somebody who's not great at planning, quicker onset for me is better. White papers show that Dysport lasts anywhere from 3 to 4 weeks longer, so longevity is important in treatments that you're getting on a regular basis, because if you can eke another month out, all the better. And studies show that there is a protein in Botox that your body can develop an antibody to, which means in a very small percentage of the population, and it doesn't happen to everybody, is that Botox over time cannot work quite as well. Dysport does not have that protein, which means from the first time to the 20th time that you get it, it will work the same. We opted for Dysport, but like I said, they're all excellent products. Dysport, Botox, Xeomin, Newtox, any of the neuromodulators on the market are used to help stop static lines from forming. The static lines are lines that are there when you're not making the movement. So for example, when I move the muscle to try to be angry in between my two eyebrows, you can see that I can make a dynamic wrinkle, but I don't have a static wrinkle. That static line would be there had I not been using injectables over the course of years. Melissa had Dysport injectables 2 weeks ago, so you can see that the muscle movement in this area is a little bit impaired. It eventually, over the course of the next month or so, will completely kick in, and she probably will not have a lot of movement in that area at all. Dysport can be used in many, many areas on the face and down into the neck. Typically here at Lift, we'll inject in 3 main areas, that being in between the eyes, getting rid of those angry lines right there, in the frontalis muscle, which is the muscle that runs across the forehead, and then into crow's feet, which of course Melissa does not have, but that's oftentimes clients are concerned about crow's feet on the side of the eyes. There are many different areas that you could inject Dysport. You could do it into the bunny lines in the nose. You could do it into the chin. There's something called pomme d'orange that people get, and it's basically just orange peeled chin in this area. A couple of units of Dysport will absolutely help that. Some people do it into the upper lip area. If you have vertical lines, if your sins of the past, perhaps you're an ex-smoker or have been in the sun quite a bit, oftentimes clients have those vertical lines. And if you think about your lips being almost like purse strings, we can stop that purse string from tensing or pulling, so you can't purse. This application is not for anybody who likes soup, drinking hot beverages. If enunciation is incredibly important to you, you speak for a living, you're about to give the speech at your daughter's wedding, do not ever get Dysport into your upper lip. It's a really bad idea. People can use injectors can use Dysport into the platysmal bands. That's not something that we often do here at Lift, but it certainly is something that you can use Dysport or any of the neuromodulators for. And then also into the masseter muscle. Sometimes clients have TMJ, the masseter muscle injection can absolutely relieve that. Or if they just want a slimming of the jawline, injections into that muscle can do that as well. So Dysport is always charged by the unit. So when your injector injects it into the muscle, they'll put in a certain specific number of units. Here at Lift, I can give clients typically a ballpark where the nurse injector or Dr. Hadlid would go with the number of units in the area. For Melissa, if she was to come in to see me for a consultation, knowing full well I am not the final say. It is in consultation with you and the doctor to get your desired results achieved, but I can give you a pretty good idea. So I think that in this area, I would recommend to Melissa, she would probably get around 16 units along the forehead, typically around 14 units. In the crow's feet, depending on the depth, anywhere from 6 to 8 units per side. So when you're looking at the charge per unit, you can use that as sort of a ballpark. I usually say around 30 units total for the forehead, and then around 12 to 14 around the crow's feet. We often get asked, how long does Dysport last? And that really depends on how quickly your body metabolizes the product. It can be anywhere from 3 to 4 months. Some people do get a little bit longer, but if your body metabolizes the product very quickly, you could get anywhere from 10 to 11 weeks out of it. It just depends on your system. Clients often ask, does it hurt? Is there any downtime, or will I bruise? It is an injection. The needles that we use are very tiny, little 32 gauge diabetic needles, but it is going into the skin, so there is the opportunity for a bruise. As I mentioned earlier, it's not something that you're going to do the day before a big event, because if you do get a bruise, you are going to be sad. As far as if it hurts or not, it doesn't. It's virtually painless. Oftentimes clients remark that the doctor or nurse is completed the treatment before they even know it's happening. After it's described to them, they just sit back and then it happens and it's over. And as far as the onset, you will start to notice results with Dysport within about 3 days. It is really important to caution first-time Dysport clients or Botox or Xeomin or Nutox. The first time you get this treatment, within about 2 days, your forehead is going to start to feel very heavy. And that's because the muscles are their ability to move is going to be impaired. And what that's going to do is give you a heaviness in the front of the forehead. It's very common, it will go away. The ancillary muscles will kick in, you will start to get used to it, but we always caution first-time injectable clients for neuromodulators that heaviness in the forehead will happen. If you're within 1 week of your original injection appointment and you're still not seeing the results you were hoping for, we really caution clients to wait that full 2 weeks post-injection to see the full results settle in. Oftentimes things will change in that 7 to 14 day window. But if you do need to come in, call us anytime. We will get you in for a follow-up. But for full results, clients should be waiting that 14 days. The other side of the coin of our cosmetic injectable treatments are soft tissue fillers. Soft tissue fillers are cross-linked hyaluronic acid products that are injected into an area to add volume or build up structure. Oftentimes you will see online people talking about getting their lips done or getting a jawline remodeled. More often than not, that is a soft tissue filler. And what you'll see is this is the product that is to be injected. It's a cross-linked hyaluronic acid gel that is injected into the skin. There is an anesthetic component in here, so as it goes in, it will freeze. And so oftentimes you will see clients getting products such as this injected into the cheek, the lips, the jawline. If Melissa had very, very deep lines in the forehead or in the crow's feet or essentially anywhere that she was very concerned about, the application for this product would be after we tried to correct with some Dysport. Because what happens is if she had a very deep furrow in the middle of her brow, if we were to add a hyaluronic acid filler into there, the product is soft and malleable, and so she is continuing to make that dynamic muscle movement, and then it would push in the product. It would just form, the product would form around that wrinkle. What we need to do is arrest that muscle's ability to move, and then we can go in and correct the deeper line with some hyaluronic acid filler. There are several different excellent soft tissue filler brands on the market today. We use a few of them here at Lift. The difference between the individual products underneath the big brand umbrella are the different viscosities and the cross-linking of the proteins within the hyaluronic acid gels. If you were to use a product in the jawline that you would use in the lips, you wouldn't get the same benefit, because the one that you use in the jawline, you want it a stiffer product. You want that to build out structure. In the lips, you want something that's just a little bit softer. As you can imagine, when you kiss, you want it to be a product that is malleable and unnoticeable. Sometimes you will notice a little bit of product in the middle or in the inside of the mouth when you get injectables, but for the most part, when you're injecting around the mouth or in the lip area, you want something that's much softer than something that you would go directly onto the bone, where you would in the cheekbone area or in the jawline. Soft tissue fillers can last anywhere from 3 months up to 18 months, depending on where they're injected and the type of cross-linking that is within that product. Something that is injected deeper down onto the bone where there is not a lot of movement, typically that will last a little bit longer. If you're somebody like me who talks for a living, or Melissa, we get injectables into our lips. And Melissa when's the last time you had injectables in your lips?
August.
In August. So we often will get our lips done twice a year. How often do you get yours done?
I think once a year.
Once a year?
Yeah.
And so you had yours done in August, and how much did you have put in?
Half a vial.
Half a vial. But it's important to remember that once you get an injectable put into an area, you are never going back to baseline. There is a collagenesis process that happens within the area where you put the injectable. And so your lips, for example, with Melissa, over the course of the last 3 years, I think you've had them done...
I've had 2.5 to 3 vials fully.
So let's say 3 vials completely over the last 3 years. Now that first injection of 1 vial, in all likelihood, that product is entirely gone. Melissa's body has absorbed it. But the product that was injected 18 months ago or so, she's probably got a little bit left in there. And so what we're doing by slowly injecting Melissa's lips is we're building on the previous injections. But if she was to never get injectables again and go back to her natural lip shape, they would never go back to how thin they were before. Not that they were thin, but they would never go back to baseline. Because we've created a micro injury in that area, we've created a collagenesis process, which in turn is going to add some volume. With any injectable, whether it be Dysport, soft tissue filler, anytime you're breaking the skin, there is a very, very small opportunity for infection, which is why we always keep the area very clean. We encourage clients to do so post-treatment. Now, if you were to come in for cosmetic injectables and tell us my daughter's wedding is in a week and I want my lips done, we would wish you all the best, but there's no way that we would be doing that treatment. And the reason being, the opportunity for bruising is always there. And Murphy's Law, it's going to happen to somebody whose daughter's wedding is a week away. We want you to have the best experience and outcome possible with any of our treatments, and cosmetic injectables, of course, being my favorite, and I want everybody to love them. I don't want you sitting a week from now at your daughter's wedding embarrassed because you have a bruise on your lip, because it can happen, and it does happen. I have had 2 black eyes on my birthday because I convinced my doctor to inject me. And that's entirely on me, and I know the risk, but we don't do that. As far as downtime after this treatment, depending upon where you are injected, if you are injected mid-face or down into the bone area, you can have some bruising and it can feel sore. The muscles, when you smile or when your face moves, will feel different because they're going to move over the product that's been injected differently. If you were to, oftentimes clients wonder about tear trough filler. Absolutely, that's something that we can do and do in a very safe way, but you can get some bruising in that area. So again, it's something that you want to do when maybe you have a little bit of lead time towards a special event or a big day, or if you just want it for every day, then of course we can, if you do get a little bit of a bruise, we have lots of makeup and concealer, and our team can help you look perfect after injectables. But if you have a big event, don't do this treatment a week before. In order for your treatment to be as safe and as comfortable as possible here at Lift, we use a few different things. We can use a topical numbing, which nickname is BLT, and it's basically just a topical agent that we put on the forehead, into the crow's feet, or anywhere that the doctor is going to be doing an injectable. Starts numbing within about 5 minutes, and it's very effective. It goes away after about an hour and a half. The next is an injectable anesthetic. We have this with epinephrine or without epinephrine, depending what the doctor or nurse decides to use. And we will inject this, the doctor will inject this into either the area that he's going to inject straight into, or he will use it where he's going to put a port for the last step in our safety protocol, which is something called a cannula. There's a lot of confusion about cannulas, and so I thought I'd go over it quickly. This is a cannula, and it is typically used when you're injecting into the tear trough area. This area is definitely a no-go zone for needles. The doctor has always cautioned us about talking to clients about injectables in this area without the use of a cannula. So the doctor or nurse will inject typically about out here with some injectable anesthetic, and then use the cannula. This is plastic, and it looks like the end of a sewing needle. So you can imagine the top of the sewing needle is actually rounded, but there's almost an eyelet at the end, and the product comes out the side. And so what happens is that there's no opportunity for puncture of blood vessel in this area. So it's very, very safe. And so the injector starts out here, the cannula comes in here, and then they drop product into this area. So this rounded end cannot puncture a blood vessel, it can't puncture a vein. It's the safest way for us to inject into the tear trough area. Thank you so much for watching our video, and thanks Melissa for being my beautiful model as usual. If you have any questions about our cosmetic injectables here at Lift, call us anytime. Consultations with our nurse, our doctor, myself, Melissa, they're all complimentary, and we'd love to meet you and talk about how this product or any of our other services could be beneficial to you.